Hi, Dr. Masa at L.AC Chiropractic Clinic. Today's topic is high fever child acupuncture. High fever signs and symptoms can include running nose and nasal congestion, watery, itchy, red eyes, sneezing, cough, itchy nose, roof of mouth or throat, swollen blue-colored skin under the eyes, postnasal drip, fatigue. There are two types of allergic rhinitis or high fever. One is seasonal. Symptoms can occur in spring, summer, and early fall. They are usually caused by sensitivity to airborne mold, spores, or to pollen from trees, grasses, or weed. Another one is perennial. Symptoms occur year-round and are generally caused by sensitivity to dust mite, pet hair, or dander, cockroaches, and mold. I will introduce and demonstrate how Japanese-style child acupuncture treat high fever, or it's called allergic rhinitis. These are typical Japanese-style acupuncture needles for children. It's not really needles. It just stimulates skin. That's why it's gentle and painless, especially for kids. One of the most important acupuncture points for high fever is Ashi Sanri. Here, we use this kind of acupuncture needle today. This is not prick the skin. It's a spring inside and gently stimulate like this. Unlike an adult acupuncture needles, we do not insert needle and leave the needles. So we continuously stimulate acupuncture point couple seconds and do the same thing on the other side. We use this roller type needles also for the kids. This is not insert the needle in the skin, so just touching. It's painless, but some kids feels a little itchy or ticklish, but not painful. Lightly stimulate and see the skin color change. And move to the other side. When skin color change a little bit, it's a good enough stimulation. Another important point for high fever is shakutaku here. And gokoku here. and around the belly button. Sometimes we use this kind of acupuncture needles. And you can see the skin color change to red. It's a good enough stimulation. This one also here. You can see the skin color change slightly turn to red. It's a good sign the body is reacted. Then stimulate head and face acupuncture point. Here is a josei. And hyakue. And Indo. And Sanchiku. And Bitsu. Geiko. You can see the slightly change the skin color, those acupuncture point where I stimulated. It's good sign to body's reaction. Japanese style acupuncture for children takes 5 to 10 minutes. It's safe, effective, cost effective, and also very gentle. High fever is very uncommon in the United States and in the world today. I highly recommend the parents do the home care acupuncture for kids. This needle may be replaced by toothpick, and this needle may be replaced by teaspoons. So gently stimulate here and also here. You don't have to remember the name of the acupuncture point, just a place in between eyebrow, close to the center line. The name is Indo, but you don't have to worry about the name. Indo, and Geiko just laterally to the nose. Use the toothpick and gently touch like this, and when the ski color change, stop right away, and then stimulate here too, and replace this by teaspoons and then gently scratch like this, may help. And also Gokoku is here between thumbs and second fingers meet together, this part. So use the toothpick to stimulate like this, or teaspoon scrub like this, and the ski color change to the red, it's enough. However, if it's not enough, let your kids bring to Japanese style acupuncture. It's safe, effective, and you will be happy what you do. Thank you for watching. Bye.